Hey everybody, it's Dr. Wood, and today we're going to be talking about different types of research. Now, some of these you might already know, we've probably talked about many of them, but again, this is a quick overview, just a bit of a refresher to get you ready for when you actually start pouring through all of your papers and pieces of literature, and try to decipher all of it. What does it mean? Basically, when you're looking at research, I'm kind of defining kind of where we are all at in the process and where other things may lead. But let's say we're starting out with, all truth in the universe here. Let's say everything that is to be known in the universe is right here. And within that, we have some kind of problem in practice, right? So maybe we don't know the most effective means of treating a given disease state, or maybe we have two different types of drugs that are, we don't know which one's more effective or more safe or things like that. Um, and from there, and this is kind of what you've already sort of come up with in your proposal, from there we want to define the problem to see specifically what is the issue, where is the deficiency, and how do we want to find out how to make up for that potentially. And from there, that's how we develop our hypothesis or your research question. Or, if you come up with these two here, especially your hypothesis, you'll already know essentially what your null hypothesis is, right? So if you're saying with your hypothesis that I think that X will be better than Y, then obviously your null hypothesis would just say, well, there's no difference between the two there, right? We'll talk about errors a little bit later in a different video. So from there, we're going to do our literature review. And so you kind of are at two branching points here. And so your answer is either in the literature or it's not. And we're going to kind of stop here, right? So for the majority of our papers that we're writing, these are just going to be literature reviews to try to see what's out there in the literature, what's available, maybe what's not available, what are the shortcomings, and maybe postulating some ways to try to help manage that in the future, how to try to come up with a study idea or something like that. But ideally, you'd like to find your solution, right? So say you're working in the clinical setting, you have a patient who shows up with a disease state, you don't know how to treat it, you're looking up to date, boom, you got your answer right there, your solution discovered, you're kind of done at that point. But we're looking at these kind of research questions with the idea that we don't know what the full answer is, right? Maybe there is not currently an accepted best answer, or maybe you're trying to learn what the best answer is. And from there, we can go on. And so that's kind of what the literature review is going to be doing for us, right? So let's say that we had more resources available to us, or say we wanted to try to come up with our own answer, or try to find out what the actual answer is. And from there, that's where we kind of develop more study designs and methodology. From there, once that gets approved through the IRB, which I'll talk about a little bit later on in a different video, then you can go through with your data collection. You do your data analysis. Typically, you hand your numbers off to a person who is a biostatistician who is designed, or is their whole job is just to run stats and develop p-values and all these types of things like that. And then you get your results. And from there, you try to make heads or tails of it. You try to interpret what all of that means, and you come to some conclusions. And once you have that, hopefully you've come up with something that is publishable. In some cases it is, sometimes it's not. And you can disseminate it out, right? So either that can be like a poster that you could do at, say, a conference. It may be a presentation you may be giving, as like a grad project potentially, or you could do it for an actual publication where it would end up in a journal, right? So this is kind of the general flow of things in terms of coming up with your question, defining a problem or some deficiency in the literature, and then where do we actually get down into how the journals actually come about, right? So in looking in terms of our levels of evidence here, we can kind of look at it sort of like a pyramid here, right? And so looking at the strength of evidence, at least in terms of how it applies to clinical medicine, right? So for instance, if you saw some test tube research, meaning it was done, say, in some animal cells, there's a cell culture, and they try to figure something out, that may not be necessarily as strong of evidence as compared to, say, like a randomized controlled double-blind study, right? And so I'll kind of go through these briefly here, but I want you to think about this when you're going through and looking at your different references. Where does it fit within this hierarchy in terms of the strength of evidence? Because if I'm researching a particular question and I have, say, a case series, and I also have a randomized double-blind study, you should put more credence in the randomized controlled trial than you would in just a simple case series, because this is more difficult to manage. You can control for more variables. It's a stronger piece of evidence than, say, something like a case series is, right? So to get into these more specifically, when I say in vitro research, that just means test tube research. I got to do this for a summer as part of an internship, and that definitely turned me away from ever doing that again, because it was the most boring thing I've ever done in my entire life. Some people love this, and God bless them. Peace be with them, because they can do that all day long, right? Now, what are the limitations of this? Well, basically, we can't really apply this directly to humans, right? However, the nice thing with this is that you can do it relatively, may not be easy, but you can do this without involving actual human subjects. So there's not a lot of, ethical quandaries you're going to really wander into. It's relatively easy to work with a cell line as compared to with human beings, for instance. And so they are useful to help us to generate ideas, right, in terms of generating hypotheses that we may be able to take and then apply back to humans potentially. So not directly applicable, but it could be useful. This may be good background information for your paper. It could be useful in order to sort of hypothesize, okay, well, we saw in this cell line that if we did this thing happened. How might this apply to people, right? So it's good for idea generation in a lot of cases there. Next, we have animal research. This is mostly done in mice and rats, and you can find other animals too, like rabbits or monkeys. And I'm sorry for all the animal lovers out there, but it does happen. In these cases here, you have to also think about the applicability to humans. It's not always going to be one-to-one. And while you may be able to get some good, evidence or information to extrapolate to humans, a mice or a rat is just not going to act exactly the same as a person is. But again, it could be useful, especially if you're doing something, say you're looking at really sort of not far-fetched science, but things that are going to be happening in the future. So if you're looking at a specific disease state and you're thinking about how might stem cell research be applicable here, there may not be human studies to show any evidence for benefit or not, but there could be animal evidence. And that's totally appropriate to include in your paper, because again, this is useful for helping to generate hypotheses. You can be speculative about this. That's totally appropriate, and can serve, these studies can serve as a proof of concept, and they can potentially be a stepping stone in order to get to that point where you could do it in humans, right? All of our drugs that are out there, they have to be tested in animals prior to being tested in humans, and that's a necessary step that we have to do there. So next up we have case studies, and this is actually one of the easiest ways to get published that are out there, either with a poster or actual in a journal. Generally, these are going to be an N of one, right? So it's going to be one single person. You see it out on rotation, or you're working and you see something novel or something very rare. This is a good opportunity to be able to disseminate that out to other practitioners, right? It may not be applicable to other patients potentially, because it could be sort of a one-off sort of thing there. But when you see these case studies, this is also useful for looking at background information too. So typically they include like a review of the topic, or they'll actually look at other similar cases that have happened, and that can give you some jumping off points in terms of looking up other pieces of literature and things like that. This is another case where it could be useful for prompting further research. If you see this really kind of novel thing in one person, well, maybe other people will develop that too, and you could do further studies there. So I went ahead and just picked a sort of random journal article that I found out there on PubMed. So let's just go ahead and click here to see what pops up. I mean, this was completely random. I had no idea what kind of study was going to come up. I just knew it was going to be a case study. And so pulling it up here, this is from the Journal of Pediatric Pharmacology and Therapeutics. It's the oral absorption of enteral vancomycin in a child with Clostridium difficile, colitis, and renal impairment. Written back in 2013, which is painful how old this article is, and written by a couple nobodies. I wouldn't worry about the authors too much here, but point being, all kidding aside, this is actually something that I saw while on rotations during my fellowship, and I thought was really interesting and something we don't see too frequently. This is actually a patient who was being treated with oral vancomycin and actually had detectable blood levels, actually at therapeutic levels, which is very odd, and it had to do with the severity of her colitis and renal impairment and all of that, right? I'm not going to get into the details, but You can see here how a one-off case study could be useful for one, helping you to get published, which is always a good thing. And then two, it's useful to send that information out to other practitioners. Now, keep in mind, this is a pretty niche sort of topic. And so, this is not going to get published in JAMA, right? There's no way it's going to happen. But if you find the right audience, that can be totally appropriate for them. So for instance, this is the Journal of Pediatric Pharmacology and Therapeutics, like a pharmacokinetic analysis of a random drug interaction or random drug side effect. Perfectly up their alley. May not be good for, say, an infectious disease journal. This would be too narrow in scope there. So we'll talk about different journals later on in a different video and give you some better ideas in terms of trying to find the correct audience, say that you wanted to go and try to get published potentially. So going on, next we have case series. Again, this is typically like a case report. It's a little bit stronger in terms of evidence because you have more than just one person. Usually 2 or more cases. They can be up to a dozen or more in some cases there. And the nice thing here is that instead of just having N of 1, which could just be a random one-off, these tend to show trends or commonalities amongst cases and may be applicable to other patients. And again, it's not super strong evidence for that X therapy is better than Y therapy. But, it's, again, better evidence. You can make a stronger case within these cases here. A lot of times they won't do a lot of inferential statistics. So for instance, when I say like doing a student's t-test and coming up with a p-value, you won't see a lot of that because the studies weren't, or the groups weren't really controlled for. There's no control group to really compare anyone to. Frequently they will do descriptive statistics though. So if you're looking at blood pressure in patients with a certain genetic polymorphism, you could use an average blood pressure, right? That's a descriptive sort of statistic as opposed to like an inferential one. And keep in mind, correlation does not equal causation. So just because you see 12 patients who have the same sort of reaction to a drug or to something does not mean that all patients will have that. So it's important to remember, because you don't want to draw too many conclusions. You don't want to necessarily hitch your wagon to just a case series and say, look, I found the answer, because this isn't the strongest of evidence that's out there, right? Now, case control studies, I know we talked about these in our EpiBio class from many semesters ago. Again, more strength in the evidence here. Typically, we're going to start to make some more inferential statistics, make more comparisons. Remember, these are generally retrospective, and they're relatively easy to perform, and because we already know the outcome, right? So basically, you take people and you would sort of group them based on whether or not they had a certain outcome. So if I'm looking at death, for instance, in terms of related back to COVID, for instance, I know who's dead and who's not, and I can use those as 2 different groups and then look back in time to see what sort of risk factors they might have had. Maybe certain risk factors were more prevalent in the people that died versus the ones that did not, things like that. And again, good for associating risk factors with particular outcome. Here, remember, you're going to be using a lot of odds ratios. You'll typically see that if you have case control studies. Again, these are more plentiful because these are relatively easy to do. If you have access to a set of charts, you can do a case control study. This is essentially what I did. Something very similar to this when I did my research in fellowship, for instance. Cohort studies are going to be, again, stronger than a case control study because now it can actually group up patients based on presence or not of a risk factor, and then I follow them for an outcome. So say, for instance, I'm looking at patients who are diagnosed with COVID-19. I then group them up into people with hypertension and people without hypertension, and then I follow them to see who dies and who doesn't, right? That would be a cohort study. No, there's no randomization here, so I can't necessarily take into account outliers, right? So maybe the people with hypertension skew older than those that don't. Those are things you want to be looking for in terms of baseline differences between your groups. Hopefully there's not differences there, but they can be useful. Again, more intensive in terms of resources required to perform one of these versus a case control study, but not nearly as intensive as a randomized controlled trial. So it's still pretty good. You'll see definitely a lot of these that are out there. These tend to be more prospective, but they can be retrospective. So just depends on how they organize the study. And then we get to the randomized controlled trials, the RCTs. These are sort of the gold standard in terms of getting causative information out of a study to try to find cause and effect sort of relationships. This is the way to do it, right? So typically you would either randomize people into a treatment group or a sort of intervention group, and then you'd have people either getting placebo or some sort of standard of care, some control group, and then again following them for their outcome, right? And we'll talk about ethical considerations coming up in a later video there. Remember, blinding is really important for these. Basically, you just take your two fingers and do like that to the patient. I'm kidding. Basically, that means that the practitioners who are holding the study and the patients have no idea what group they're in, right? If you're doing, say, like a drug trial, you have to make sure that both the control and the intervention groups, the drugs that they're receiving, look identical to one another. Otherwise, patients might know which group they're in, right? So, for instance, in a lot of studies we do at Nemours, frequently we'll have our research coordinators who are nurses, we'll have the doctors, we'll have any other associated providers, we'll have the patients. No one knows what group anyone's in except for the pharmacist, because we got to figure out which drug they're going to get. They're going to get the actual drug or the placebo potentially. And so that's kind of a power trip you get to, right? Because everyone's like, what group are they in? You're like, I can't tell you, because if I break the blinding, then that can introduce bias. And we'll talk more about bias a little bit later on there. But again, if you can find a nice randomized controlled trial to give you some evidence, that's great. That's something you can definitely hang your hat on, assuming it's performed appropriately. And then following that, then we have our systematic reviews and meta-analyses. So you're basically kind of doing a type of systematic review of the literature for most of your papers here. Meta-analyses, again, and you'll find that there are certain databases of these. So like the Cochrane review is great in terms of having a ton of different meta-analyses. And basically what they'll do is they'll pull apart or they'll pull different studies together. So even though different studies may have been performed differently, they can try to compare apples and oranges, so to speak, in order to try to get a more complete answer, right? So maybe you're doing, maybe they have a couple papers where, there's like 30 patients in this study and there's like 110 in this one and there's like 50 in this one. You can pull all that together potentially and try to get a more full idea of what actually is going on. And so Cochrane Review is a really good place to go look to see if your topic is being addressed there. And there's different types. There's quantitative versus qualitative. Typically quantitative can actually take similar studies and combine all their numbers together and try to get some inferences out of that. Qualitative is more so looking at studies that have strong statistical evidence or strong methods and trying to say, okay, well, in this percentage of studies, we showed that there's a positive effect in giving this drug or doing this surgery, whatever the case may be. But the analyses are typically limited by the heterogeneity of the studies, and that means how different are the studies from one another. If one was an RCT, one was a case control trial, that's pretty heterogeneous. They're not very similar in terms of their study methods, and so that can be more difficult to pull inferences out of that. Versus if I have a bunch of RCTs that run relatively similarly, maybe they change like the dose of a drug or something, that can be much more easy to pull some information out of. So again, you can go just Google Cochrane Reviews. That's a great place to start for most of your topics. So in conclusion, there are many study types that are out there, and it's important to know what sort of takeaways you can get from those different study types. You can't look at a case study and say, boom, I got my answer. I already know what my conclusion is going to be for my paper. That doesn't work that way. If you find some RCTs, though, that's a totally another ball of wax, right? So that's very strong level of evidence. You're able to make a lot more cause and effect sort of inferences about that sort of relationship, right? Case studies are the weakest, but sometimes you got to do what you got to do, right? You're very rarely ever going to find RCTs being done in toxicology because it's just really difficult to do, and it's not super ethical in a lot of cases there, right? So sometimes I got to go with a lot of case control studies or cohort studies. That's the best I'm ever going to get. So it depends on the topic and depends on what you're looking at. But overall, that's the different types of studies you're going to run into. If you have any questions, though, let me know, and I'll talk to you soon. Thanks a lot. Bye.